Hi, my name is Nazatul Anisha. So what is Microsoft Teams? Microsoft Teams is a platform for collaboration and communication created by Microsoft. Surprisingly, it is part of the Microsoft 365 range of productivity tools and serves as a center for organizational teamwork. In fact, Microsoft Teams has a number of features and capabilities that are designed to improve communication, collaboration, and productivity among team members, whether they are working in the same physical area or virtually. So what Microsoft Teams can offer us? So generally, Teams allows users to exchange message, emojis, and files within the chat interface. It can be either one-on-one or group conversations. Secondly, Teams also allows users to schedule or join video and audio meetings. It also supports screen sharing, whiteboarding, and virtual backgrounds. Next, Teams are organized into channels which are dedicated spaces for specific topics, projects, or departments. This really helps keep discussion and files organized. And lastly, Teams integrates with Microsoft 365 applications, making it easy to share and collaborate on documents, spreadsheets, and presentations using apps like Word, Excel, PowerPoint, or even Skype. Did you know that there are more than 1,900 applications available in Microsoft Teams today, making it the most popular business communication service in the world? Also, the number of Microsoft Teams users increased from 2017 to 2023 with roughly 300 million users in 2023. Amazing, right?
These are the software roles in the healthcare. Telemedicine consultation are a critical component of modern healthcare, leveraging software and technology to facilitate remote medical visits between patients and healthcare providers. Telemedicine software provides the digital infrastructure for patients and healthcare providers to connect and communicate remotely. This includes video conferencing platform, secure messaging system, and voice call capabilities. Software plays a critical role in facilitating and enhancing collaboration among healthcare teams in several ways. First, software plays a critical in facilitating and enhancing collaboration among healthcare teams in several ways. First, all team members can access and update patient records, ensuring that everyone has access to the most current and relevant information. This promotes a shared understanding of the patient's medical history and ongoing treatment, allowing team members to exchange information, discuss patient cases, and seek clarification while adhering to privacy and security standards. Software also plays a vital role in medical education and training, transforming the way healthcare professionals learn, practice, and stay updated on the latest advancement in the field. Here's an explanation of how software contributes to medical education and training in healthcare. First, it is an online learning platform to access to resources. Software platforms offer online learning resources such as lectures, textbooks, and research articles. So this enables medical students and professionals to access a wealth of information at their convenience. Moreover, interactive modules. So the interactive e-learning modules, simulation, and virtual patient cases provide engaging and immersive educational experiences. So this allows learners to practice and apply their knowledge. Software also enable telemedicine training, allowing the medical student to conduct a remote consultation under the guidance of experienced practitioner. So this is actually especially relevant in the context of the increasing adoption of telehealth in healthcare. Through telemedicine software, learners can gain exposure to a wide range of patient cases, enhance their diagnostic and communication skills.
Next, I will be explaining on security and compliance in Teams. Microsoft Teams is HIPAA compliant, which makes it a great option for healthcare providers who need to ensure that patient data is secure. Microsoft Teams also offers secure messaging through end-to-end encryption to ensure that messages cannot be accessed by unauthorized users. Users can also set up multi-factor authentication as an extra protection for their data and information. With Microsoft Teams, healthcare providers can share files securely, ensuring that only authorized users have access to the files. This is how security and compliance looks like in Teams, which include GDPR, which stands for General Data Protection Regulation, to handle personal data as defined in the law. Data governance is also included, which helps to manage all our data and information, as well as threat management to help detect and respond to threats like phishing, malicious link, and many more. Moreover, Microsoft Teams can be integrated with EHR, or we call it Electronic Health Record Systems, allowing healthcare professionals to access patient data instantly during consultations, improving the quality of care and reducing errors. Healthcare providers can also streamline documentations of patient data, such as patient interactions, add notes, and update records directly within the Teams to reduce the need for double data entry and saving time. This is an example of streamlined workflows and shifts for clinicians and staff in Teams. Announcement can be shared across the organization to keep everyone updated on important information. Last but not least is the administrative efficiency. Teams can facilitate appointment scheduling, allowing staff to efficiently manage patient appointments, reducing scheduling conflicts, and improving the overall patient experience. Healthcare teams can collaborate within teams, discussing patient cases, sharing information, and making collective decisions, leading to more efficient and coordinated care. Administrative tasks such as sharing important documents, policies, and procedures can be performed securely within Teams, ensuring compliance with healthcare data regulations. So this is the example of administrative efficiency, which involves streamlined processes for discharge planning and multidisciplinary team meetings for patients using lists in Microsoft Teams. So I think that's all from me. Thank you.
Despite of always developing, this software also has its own pros and cons. So for the first one is, it can increase meeting productivity, especially in the case of COVID-19 outbreak. So real-time chat, video calling, and document sharing across healthcare organizations, allowing for faster decision-making and greater coordination. Next, it can also secure communication. Teams make it possible to get all the healthcare organizations on board at the same time in a HIPAA protected clinical environment. So it is a one tool with multiple capabilities. So Teams serve as an all-in-one for fostering productivity, collaboration, and communication across all frontliners. So for these advantages, data breaches and cybersecurity threats remain a constant in healthcare. Next, learning this software might be time-consuming for new healthcare workers, and it might affect their initial efficiency. And healthcare organizations need to spend more money on it for more features and to connect with other Microsoft products. Lastly, integrating challenges with existing healthcare system and EHRs can be difficult and time-consuming. To conclude, Microsoft Teams has shown to be a useful tool in healthcare field to promote faster, easier, and effective communication and cooperation between the healthcare organizations. Its safe and compliance features have made it as a reliable platform for exchanging patient data, deciding treatment plan, and coordinating care in a fast-paced and regulated settings. Other than that, Microsoft Teams has facilitated communication and boosted productivity in the healthcare settings by integrating video calling, instant messaging, share files, and scheduling tools. The capacity of this software to facilitate remote work and telehealth consultations was important, especially during the time of crisis. For example, during the pandemic of COVID-19, when healthcare organizations needed to swiftly adapt to new means of providing treatment to those infected patients. So during the pandemic, the users of Microsoft Teams has increased, going from 20 million to 44 million and 75 million in April, which has surpassed Zoom from February to June. So during this time, the Microsoft Teams was not only used in healthcare but also in educational institutions and other businesses. So there are 183,000 educational institutions were using Microsoft Teams during the pandemic. It was able to keep these users after the pandemic and has grown significantly since then. As shown in the statistic, the daily active users for Microsoft Teams has increased from 2019 compared to daily active users for Slack, which is another communicating tool. Nevertheless, while adopting to Microsoft Teams that has always evolved, healthcare organizations must recognize the necessity of rigorous safety precautions, data protection, and regulation. In the healthcare industry, keeping patient data secure and following legal regulations are critical.